patients optimize nutrition during cancer treatment? What are some actionable steps towards supporting behavior change during this critical time? I'm connecting with a respected expert to learn more on this Patient Empowerment Network Restore program. Dr. Thompson, how can changes in daily habits like diet and exercise really impact cancer care and recovery? And why is this something that patients and care partners should pay attention to?
Well, importantly, we move every day and we eat every day. And we can make decisions about what we eat and how we move that really can optimize not just our response to cancer treatment, but also our longer term health, right? And keep that cancer at bay, as well as reduce comorbidities, things like diabetes or hypertension that might sneak up on us as we age. And so it really is important to make healthy decisions about what we're eating and how active we are as cancer patients, but also in general, everyone needs to think about these things.
Okay, thank you. And Dr. Thompson, in your study, self-regulation was strongly associated with meeting nutritional and physical activity recommendations. What strategies could be employed to enhance self-regulation in cancer survivors, particularly through mobile app interventions?
Yeah, so, self-regulation is always a bit of a challenge for each of us, but it's so important, right? And it starts really with mindfulness and really thinking about the connection between what we eat, how active we are, and how it affects our health. And believe it or not, a lot of people really haven't given a lot of thought to that. And it's amazing to me because as I work with patients, what I realize is when they make that connection, when they realize how much better they feel, it makes them kind of self-motivated to continue to self-regulate. Now, there are a lot of different ways you can self-regulate, and one is self-monitoring. And I think that's probably, the most common. Many of us have our watches, right? We have our little devices on our wrist that we use to monitor our activity and perhaps our sleep and maybe even some health outcomes. But in addition, you can do things like think about how you walk through the grocery store. Do you start in the produce section, right? Instead of going to the cookie aisle. You can think about where you park your car and are you allowing yourself to park further away so that you can walk? So setting some of those self-regulatory behaviors can really help. You can, in terms of eating, write down what you eat. There are literally hundreds of apps where you can download information about what's in the food you eat and guide yourself to make better choices. Most people will get tired of writing down what they eat. And so usually if people want to do kind of the written or the app approach, I'll recommend that they pick a few days of a week or maybe the first week of the month and not burden themselves with doing this day in and day out, because over time it begins to lose its excitement. The feedback that you're getting is not quite as enticing, and you begin to feel burdened, and you may even change your habits for a lower quality diet simply because you've kind of had it with the app.
Okay, thank you. Now, for patients who are trying to monitor what their intake is and what their diet looks like, and maybe they do have access to an app, but maybe they don't. Do most cancer centers have a dietitian that a cancer patient can work with on nutritional information surrounding their cancer diagnosis?
Well, Lisa, I wish they did. But, the data that we have suggests there is one dietitian for about every 1,208 patients, which is just dismal. So I do think it's really important to, when you're in care, to ask for that referral and try to get in with an oncology dietitian. There are dietitians who practice outside of oncology that certainly can be helpful, but they're not going to have the insights that you're going to get from an oncology dietitian. You may have to go to a larger kind of academic or what we call comprehensive cancer center in order to locate a dietitian with this expertise. But I think, it's important to speak up And maybe we'll get more dietitians on staff if patients advocate for this important information and support during their care.
Okay, thank you. Dr. Thompson, how do you think self-efficacy and self-regulation can be effectively promoted in cancer survivorship programs, especially among populations with lower initial adherence to health behaviors?
Well, I think there's a number of different ways that we can, help people to self-regulate. I think the important thing is to meet people where they are. I think a lot of times as professionals, we're really quick on giving advice that comes from our own context and our own set of values and beliefs. And most times when, we're asking people to do things that align with our values and beliefs, it doesn't always work. And so many times I say it's really about listening. It's about hearing the patient and really having patients share what is it that, why are you coming to see a dietitian, or why are you interested in nutrition? What motivated you to come here today? What are you expecting to get out of these counseling sessions? And really focusing on having people understand where the gains are for them. I would say that many times it's important to think about knowledge, right? Because a lot of times people will not have the foundational knowledge to make the right choices. And certainly we need to support knowledge, but it really is much bigger than that. We have to support self-efficacy. We have to help them build belief in themselves that they can adapt a whole new dietary plan if that's what is necessary. And so I think it's really important for us to reward good behavior, support them in any way with information or advisement when they ask for it. And then also to really make sure that we repeat, because I think a lot of times, especially patients in cancer therapy, are dealing with a lot. And if you're trying to work on changing your diet on top of everything else, sometimes it goes in and out, and you have to kind of be there to repeat the messaging and support all along the way.
Okay, thank you. You heard it here directly from the expert. Thanks for joining this Restore program. I'm your host, Lisa Hatfield.